So this podcast is designed to help you understand how to navigate the NHS, and I'm delighted to be joined today by Dr. Ollie Hart. I will ask Ollie to introduce himself, and then we're going to run through a few questions about what it's like to be a clinical director in a primary care network. So welcome, Ollie.
Hi, Linda. It's lovely to be with you. Thanks for inviting me.
So if I could hand over to you to introduce yourself and explain who you are.
Yes, probably like a few GPs out there, a bit of a portfolio career. So I've been a GP partner for 20 years. I recently stepped out of partnership to focus on a range of things. So I'm a clinical director in a primary care network. Been there for 4 years since they started. I also a director in a training company that teaches people how to use health coaching in the NHS called Peak Health Coaching. And I still do some GP work as well.
Lovely. And I think your PCN is Heeley Plus in Sheffield, is that correct?
That's right. We're one of 15 PCNs in Sheffield.
Lovely. So could you explain to people what is the role of a PCN?
Yeah, I mean, it's a bit like everything in the NHS. We're sort of building the plane whilst it's flying, aren't we? And PCNs are a really brave attempt, I think, to align groups of GP practices usually in a common geographical area to work together and collaborate, but to expand the scope of what primary care is able to do, primarily linking together health and social approaches. So we work together with those, for instance, my PCN Heeley Plus, there's 7 GP practices. We kind of collaborate over health delivery, but we also partner with community providers around sort of, social prescribing and trying to build a more holistic approach to healthcare together.
Okay, so who are the PCNs accountable to?
Well, that's a very good question. So primarily it is primarily it's governed by health organisations. So the contract is held by the PCN, and the practice is the GP practice within it. So and they're accountable to an NHS direct enhanced service. So the accountability at the moment is to the health system, through to NHS England, but their remit, if you like, is to try and expand out the scope of what health does. And I think that's why they put general practice in the middle of it, because I think traditionally we've been good at trying to bridge that gap between, medical science and real life communities. We've always sat in the middle there.
Mm-hmm. And these ICBs, ICSs, people are often confused about how they operate in relation to primary care networks. Can you cast any light on that?
Yeah, so with the new health bill, integrated care systems are they're kind of, if you like, the overarching body for an area, and PCNs, I guess, are the unit of delivery within an ICS. So yep, they kind of, if you like, hold some of the commissioning leadership over the top, and I guess in a way ICSs should be trying to facilitate the way PCNs work, making sure the contracts work, making sure the kind of training support is there, sort of leading on trying to get providers to talk. But in a primary care space, the primary care networks, if you like, are the unit of delivery, usually kind of covering 30 to 50,000 patients.
Okay, and your role as clinical director, what's your brief?
Very broad. I mean, technically, I'm paid for 1 day a week to. I think my role really is a leadership role. The idea is that a clinician from that area takes a leadership role. And I think what I've found myself doing most of the time is trying to build teams, trying to create a culture of collaboration, trying, if possible, to widen the mindset of all of the local stakeholders in how we work together to, think about health issues, but also those wider determinants of health that we know are so important. So, your housing and your income and your social connections are all very important in health. And it is really hard within the health contracts to find time and space to do that. So I think what I try and do as a clinical director is to provide some leadership that encourages people to think a little bit more outside the box. But I do recognise, and it's really interesting in my role at the moment, that that's quite tricky to do. So I have to work really hard within the realms of reality. I think a clinical director has to also have a reality check of what's possible within everything that's going on.
And I think if we look back, there've been initiatives like GP fund holding and other systems that have attempted to bring general practice together to create, to coordinate and have a greater impact on health outcomes. How do you think this might be different this time?
Mm. Well, I think in a lot of ways it's similar. And I believe in cycles of change, that we'll never change the system with just one go round a cycle of change. So I think it builds on a lot of previous work. We've often, Derek Wanless described, didn't he, 20 years ago, the value of engaging people, having a fully engaged population. There's been many rounds around, creating collaborations between providers and commissioners. To some degree, this is the latest iteration. But of course, every time you go around a change cycle, you learn from what went on before, and you get a bit better at it. So I don't think PCNs will be the be all and end all of trying to integrate health and social care, but I really hope it'll take us, more productively around the change cycle again, so we're getting better at it.
Thank you. And I do wonder what some of the success measures might be, because I'm sure they're pretty embryonic at the moment, but how would a PCN know whether it had been successful or not, do you think?
Well, I think there's a tension there, because I think you could judge purely on delivery to contract. So the PCN does have a direct enhanced service contract with certain things that we're supposed to do, changes on uptake of cancer screening, changes of uptake of cardiovascular screening, whether or not we're referring to social prescribing. There's a range of sort of markers in there, and you could hold yourself just purely accountable to those markers. And that might be what you call the letter of the law. But I think there is also within it a spirit of the law as well, of an ethos we're trying to create, which is that we are better working together, and we are better considering both health and social in an integrated way. And so for me, the markers of that sit between the cracks of the contract, and I think what I'm interested in as a clinical director is the relationships that we're building, the trust that we're building between different providers. And particularly, how the staff are, enjoying their job. So the PCNs are creating new roles, new pharmacists that work in PCNs, first contact physiotherapists, health coaches, social prescribing link workers. So do people in those roles feel a sense of identity? Do they feel that their job is meaningful and manageable? So I think that some of those markers matter to me. And then the other aspect, I think, is how well a PCN is engaging the local population. So if our PCN is serving 30 to 50, we've got 42,000 people in our network at Heeley Plus. Now, how many of those 42,000 people take an active role in trying to create health in their area, whether that's for themselves, by self-managing well, or whether it's for other people with peer support or, sort of peer leadership, or maybe even co-producing, being part of patient groups and being part of the design process. I think those things are things that we should start to take notice of, that are more than just the actual literal KPIs. Yeah, but maybe absolutely. I'm a dreamer.
But then, you're dealing with people, and everybody's different, aren't they? So everybody has different aspirations and different capabilities to either self-manage or to support others, don't they? So if somebody is thinking about joining a PCN as a clinical director, what's the one key piece of advice that you would give them?
I think you've got to be committed to a vision for better. I would say, like all these slightly on the edge roles, you are a trailblazer as a PCN clinical director, I think, and you need to then recognise that it'll be difficult, and you'll need resilience, and you'll need to be imaginative about ways of which you can kind of be part of that leading edge. But it's a hugely valuable role because we really need it. So if there's anybody out there that's wondering whether or not it's for them, I would say, if you believe in better and you really want to see change happen, it's an ideal opportunity for you, but it won't be easy.
That's lovely. Thank you. Well, thank you very much for those useful insights. I'm sure each person will take something away from that. So thank you very much indeed for joining us today.
Thanks, Linda. It's a pleasure.